Okay, thank you everyone. My name is Raj Mathari. I'm chairing the seminar today. Along with me is Bipin Patel, Darush Attar and Marsha Otler. We're all going to be talking about the role of community pharmacy in asthma, especially concentrating on children and young people and how pharmacists managed to help asthmatics during the COVID period. Just some basic rules. Darush, if I could have the next slide, please. Okay, if everybody can be on mute and also turn their cameras off, that'd be great. I'm quite keen for you to share your ideas in the chat box, so quite happy for you guys to put messages in the chat box. And also we'll have a Q&A at the end, and there you can raise your hands and we can have a chat there. But if we use the chat box, that'd be great. The session is going to be recorded, and thereafter there will be a link on the Healthy London Partnerships website along with the slides. Okay, I can just walk you through the agenda, Tarush, if I may have the next slide, please. Thank you. Okay, so the agenda is quite simple. First of all, I will be just giving you an overview and a context of where pharmacy is and how we hope to set out our vision for where we want pharmacy to be. And each of my fellow colleagues, Bipin, Darush and Marsha, will give a brief introduction to themselves, how they operate within the sector, and then give a talk about, Bipin will be talking about the project we did in Bexley, and Darush will be talking about the remote inhaler technique, and Marsha is going to be looking quite excitingly at how community pharmacy is using technology for online consultations. So before we go in, my name is Raj Mathari. I chair an organisation called Pharmacy London, which is 13 of the London LPCs. I also am chief executive of Bromley Bexley Dwayne LPC and Lambeth Lucian Southwark LPC. What I really wanted to talk about is I'm going to do a plug of my own. We have a community pharmacy strategy document which we worked with NHS England London region, which is going to be launched on Thursday. And the main mission of that is, Darush, if I could have the next slide, please, is we would like community pharmacy to be looking at acute care and planned care. So what do I mean by that? So acute care is where immediately patients want a service there and then, and what I'd like to do is incorporate the community pharmacy consultation services, which is referrals via NHS 111. So there are many occasions that patients run out of their medicines, or they need a minor ailments referral, and they'll phone up NHS 111. And usually, if it's of low acuity minor ailments, or they need their prescription, the NHS 111 tend to refer them into the nearest open community pharmacy to the patient. Now, I'm going to show you a slide later on which shows that the inhalers are the number one item that's requested for emergency supplies via the community pharmacy consultation services. So there's an opportunity for us to educate the patient and also ask why is it that they're asking for a salbutamol inhaler, what's gone wrong with their asthma plan. The other aspect I'd like to look at is planned care, and that's looking at long-term conditions, working in partnership with GPs, especially around the primary care networks, and providing a population health solution. I'd like to use our electronic prescription service nominated patients. So we have these patients, each patients have choice in nominating their pharmacy. So I'd like to look at these patients and be able to manage their condition. So what's happening is that I'm sure you're all familiar with the 30 to 50% of medicines that are used inappropriately, and really would like to look at and tackle those. And also, I think the stat is about 6% of hospital admissions are due to medicines. So I think I'd like to focus community pharmacy attention on those two stats and see how we can provide value for money for the NHS and also for patient care. So that's the vision that we have in community pharmacy for how we would like to interact with patients moving into the future. Darush, I can have the next slide, please. Thank you. So why are we doing this tonight? Well, I think colleagues at Healthy London Partnerships came and said, look, we really need to be doing something at an NHS England meeting, and perhaps this report still said the asthma death toll in England is still high, and we need to, working together, tackle this problem. It's still, I still find it unbelievable that even in this day and age that we have still got asthma deaths, and it's quite sad really. So you also see a document by the PSNC which is advising on the response, and some of that response is within our London strategy document. Darish, if I may have the next slide, please. Thank you. So this is what I was talking about, the Community Pharmacy Consultation Service, or as we say, CPCS. Now, if you are able to log into the Futures for NHS website, you're able to obtain all this data. So what I've done is I've just filtered the data for London and our STP, or ICS, as they like to call it. It's called our Healthier South East London Healthcare. And if you look at the top 10 medicines, bar the sertraline, they are all inhalers. And the reason why sertraline is there, obviously we had a few shortages of sertraline a few months ago. That's why sertraline is there. So you can see how many inhalers that we are giving out as an emergency supply. And there's an opportunity for community pharmacists to be intervening at that stage and asking the patient, what's going on? What's happening with your asthma plan? So that's where we are. Trish, could I have the next slide, please? Also in Southeast London, we've been working on the NHS Integrating Pharmacy Medicines Optimisation Pilot, or IPMO, and this is also looking at respiratory. So we have some, what we call some virtual clinics. I know it says Lambeth and Southwark there. I think Greenwich is also part of this as well, where we're looking to see if patients coming into community pharmacies can be referred to these virtual clinics, so they are able to get an asthma plan, and they're able to ensure that that they don't relapse and they're on the right dose and the inhaler technique is correct. So we were just about getting into this project, and that's when COVID hit, and unfortunately we're still on the sort of this project is still on the back burner. But once we get moving again and have our sort of face-to-face consultations, or maybe moving online with these consultations, we'll pick up this project again. So thank you. So what's the aims of tonight? I mean, I suppose it's to get all colleagues to be thinking about whatever sector that you work in. One of the beauties of the IPMO workstream was that it brought all pharmacists across all sectors together in one place, and our main board had everybody there from CCG, community pharmacy, hospital pharmacy, acute trust, mental trust. All the pharmacists were there across the table, and we're all working together. And I think this is probably IPMO was an excellent example of how collaboration can work. And our plan for the asthma is we need to ensure that each patient has an asthma management plan, they're using their inhalers correctly, and that can be done in any setting. In the IPMO plan, we were saying whichever pharmacist sees them, doesn't matter whether it's in the practice pharmacist or community pharmacy or hospital pharmacist, we just need to start reinforcing that effective inhaler technique, okay? And as minimum, each patient should at least have an annual asthma review. Okay, thank you very much, George. I think if we go to the next slide, and then I'm going to